Hi, everybody. It's a pleasure to be back here amongst friends, and I apologize I haven't been here for the past day. I was at a competing meeting on physical activity. It was with the Transportation Research Board, and it was very exciting to be there. But I have to admit that I was just remarked to Jim that I'm a little taken aback that here we are at a physical activity meeting, and we're not doing active applause. So for those of you who don't know what active applause is, it's after each presenter, we get a little physical activity by standing up and applauding, and so everybody gets a standing ovation. So I would like to recommend for the rest of the day that you engage in active applause. So thanks for inviting me here today. It's a real pleasure to be back here. And I had the small task. Everybody who knows me knows that I take on things that are much bigger than I probably should. And so I had the small task of trying to quickly summarize what we know about all these wonderful policies that Amy spoke about briefly. And it's really nice having a friend up here who I work with on a very regular basis who sort of laid the land for us, so I don't have to do a lot of explanation about what these policies are. So thanks, Amy. Russ has already mentioned, Amy's already mentioned the physical activity plan, and I'm going to focus today on a couple of those sectors in particular where we have some more than others, where we have a fair amount of research done looking at the big P public policies. So policies enacted at the state, district, and local levels in particular. I know the other sessions this morning will focus on some other key sectors of influence where some of the worksite and other policies that Amy briefly mentioned at the end of her talk. So I did a very rapid review. This was not a formal systematic review for those of you who are academics in the room. It was a very rapid review of some key literature in this area across the sectors and included a number of research syntheses from Active Living Research and a number of other groups. And I was really intending to provide sort of a broad brush overview of what do we know across the different sectors about what works and really where challenges exist. Because we've got a nice accumulation of literature building in this area, but there's lots of opportunities that still exist. So there is some good news when it comes to physical activity policy. I'm going to jump to the punchline and tell you the final punchline here. There's some good news when it comes to physical activity policy, and there's also a lot of challenging news. But the most important thing to remember when you're talking about public policy is that it's incremental. So policy change happens in small increments. Generally, it's very rare that you're going to have large-scale comprehensive policy changes, particularly in this area, particularly given the funding and economic and budgetary climate that we live in today. So a lot of the strategies that I'm going to talk about have been built up over time, and a lot of the findings that we see are they're in many ways siloed. And when we were on the IOM Accelerating Progress and Obesity Prevention Report Committee, we really focused on sort of the need for a systems-level perspective on things, because there's no one magic bullet here, and public policy alone is not going to be the magic bullet. It's going to require changes and interventions across all sectors of society, and so policy is one of those pieces, but it's certainly not the only one. One of the things to also remember about physical activity policy in many cases is that they tend to be self-enforcing, like smoke-free air laws. They're very much self-enforcing. And one of the biggest challenges we see is that there's local compliance and enforcement monitoring going on. And so when you don't see full compliance with laws, such as physical education laws, oftentimes there's lots of other factors going on, but part of it is there's little compliance and monitoring going on. So what do we know? Amy laid out nicely some of the strategies for policymaking in the healthcare sector, and we don't see very much in terms of big P public policy going on in that arena at all. I really wasn't able to identify any big P policy studies specifically focused on that sector, and I know later today and yesterday there were some talks about that. There was a systematic review done that really focused in on the one topic that Amy mentioned, which is prescriptions for exercise to support physical activity. And it could be a possible strategy that could actually be incorporated into recommendations as part of licensing standards and medical education training and things like that. But we don't have a lot in the big P policy arena in this area. Having ICD and reimbursement codes for some of these things, counseling, would be really useful. The education sector is where we've seen the most activity relative to physical activity policy, particularly in the arena of physical education. Bassett and colleagues did a systematic review a few years ago, and they found that mandatory PE was associated with 1 metabolic equivalent hour per day increase in physical activity. However, and we also have seen that state mandates for physical education time in schools. So mandates is the key here. In physical education, you really need the law to be required. You can't just encourage something in the physical education arena. It's not going to change what happens in the schools. But we did find that state PE time mandates at the elementary level are associated with increased amounts of time spent in PE at the elementary and middle school levels. And that it's particularly true for girls' participation in PE, that when you have strong PE laws, girls tend to actually have more opportunities for participating by about 22%. Some of the challenges remain with implementation of physical education policy. Time is greatly often addressed in the laws, but the amount of time varies greatly from state to state. So the National Association of Physical Education recommends 150 minutes of PE per week at the elementary level and 225 minutes of PE per week at the middle and high school level. State laws often don't even come remotely close to those standards. So there's a lot of work to do in that area. The other place where there's a lot of work to do, and I did a study with Jordan Carlson and Jim Salas and others a couple of years ago, where they did qualitative interviews of state officials trying to understand about implementation of PE laws. And some of the biggest challenges are associated with implementing moderate to vigorous physical activity time during PE. And there's really big challenges with monitoring, implementation, enforcement. There's a lot of focus on communication about the importance of these things, but implementing and monitoring and enforcement is really lacking, and so it leads to very little active time spent in PE. Recess policies Amy mentioned as well. One of the things that we have found with our work is that elementary schools are more likely to offer at least 20 minutes of recess daily if the state law encourages it. This is one area where encouraging something can actually help. But the big but here is what we often see in state law is a substitution effect going on. So states that tend to meet the minimum recommendations for PE time don't often meet the recommendations for recess or vice versa. In addition, as you'll see in a second, when it comes to physical activity requirements, if you look down here at the challenge on the bottom here, the wording of state laws is often such that physical activity is defined broadly when it comes to school-based policy. And so the language is worded in a way the physical activity policy could be met in school on a daily basis through a laundry list of options: PE, recess, activity breaks, and others. And it's often an or in that language. It's not an and. And so for the lawyers in the room, you know how big of a difference an and or an or can make in the way wording is done. So what you often find happening is schools will take the path of least resistance and sort of follow the one that's easiest to implement and sort of cut back on the things that are harder to implement and require more resources. After school physical activity, Amy mentioned at the end of her talk work done by Michael Beets and his group. He's done a lot of work in this area at the University of South Carolina. And what they found is that policy requirements for physical activity policy and after school programs are rarely followed. Policies that encourage PE and PA and after school programming have higher compliance rates. But the biggest challenge is that most of these policies lack clearly defined benchmarks and goals, and they're difficult to measure, so it makes it really hard to focus on understanding compliance and impact. There's a lot of work that needs to be done in this area. We have a lot of state standards governing PE time during the school day. We don't have a lot of standards governing after school or before school PA time for that matter. Shared use policies have really emerged in recent years as a key target within the obesity prevention arena as sort of a community-based strategy that can be used across sectors of society to really focus on ways to open up access to not just school grounds, as Amy mentioned, but other grounds. I live in a community where I recently saw the church land be used, and they built up a baseball field there, and so a lot of the local baseball baseball teams and softball teams are using the baseball field on the church property, and that's done through a shared use agreement. So it's not just agreements with schools, but it also could be with community-based organizations. We have found with some recent work that shared use policies can be associated with modest increases in physical activity, but quite honestly, in my opinion, they're much more awareness raising than they are in terms of having the ability to completely change physical activity behaviors, especially in the time spent in active physical activity time, particularly because the way most of the shared use policies and agreements are written right now, at least the school-based ones, they give priority to school-affiliated groups. So they don't give priority to community people. They don't give priority to individuals just living in the community to get access to these facilities on the evening, on the weekends, on the holidays, when people are out of work, out of school, things like that. So the school-based groups are the ones who are getting priority. The second most likely group to get priority in these policies are formal organizations, such as your Little Leagues, your PALs, your YMCA groups, and things like that. So the regular Joe Schmoes in the community don't have a lot of access through these community use policies. So until the language gets changed, I'm not sure how effective they're going to be at expanding community-wide physical activity opportunities. Importantly, Spankler and colleagues found that these policies are lacking in low-income communities, and a lot of that has to do with liability concerns. Safe Routes to School, Amy mentioned funding for Safe Routes to School programming. There's a lot of work that's been done in the small p arena of Safe Routes to School programs. There have been a couple of studies where we've looked at Safe Routes to School big P policies at the state level and at the school district level, and that what we found is that state laws that require infrastructure improvements around schools to facilitate active travel to school are associated with increased active travel to school, but there are some real big barriers associated with implementation of these programs, particularly in the rural communities, and increasingly lack of resources and support for implementation. There are about, I think, Bill, what is it, 5 projects now? 5 projects funded by the National Institutes of Health that are focusing on active transport to work in particular. These are light rail projects, and this falls under the transportation sector. These are all natural experiments. They're happening in Seattle, in Houston, in Utah, and a couple of other locations. Results are emerging. They're really in their first couple of years of these studies and really doing the baseline data collection, and some of them are doing follow-on. So I encourage you to look out for these studies in the coming years. And I apologize for my typo there. Zoning and land use policy, that's an area that Amy briefly talked about, and I don't expect you to read all the data on this slide or the next couple of slides, but this is an area that I've really sort of dove into in the recent years because it's something that was really lacking in the literature. There's a lot of literature from the Community Guide. Amy mentioned the study, the systematic review by Heath and colleagues from the Community Guide that looked at the importance of street scale design, community scale design, and urban design and land use policies on effectuating physical activity, but the way those policies occur are through changes to the zoning codes in particular. And believe it or not, there's very little literature out there. Actually, there's no literature out there that links zoning policies to physical activity opportunities. And so we started to do that with funding from the National Institutes of Health, National Cancer Institute. And what we're finding is that zoning policies that are much more active living oriented, they include elements in their requirements for street connectivity, for bike lanes, for trails, for paths, for mixed-use development, for parks, playgrounds, open space, green space, you name it. We tend to see more physical activity going on amongst adults in those communities. And it's consistent across all different types of physical activity. And then we also see it with regard to active transport to work in terms of adult use of public transit. In communities that have more active living-oriented zoning, people tend to take public transit more and engage more in that extra physical activity to get towards the recommended 30 minutes per day. And here's one example with mixed use, and I'm not going to go into all the detail here, but if you're interested in those studies, let me know. Complete streets, Amy mentioned there are a couple of good evaluations that have been going on in communities, and those policies are diffusing quite a bit, but we really do need to build up the evidence base in this area. I was at a recent Physical Activity Policy Research Network meeting, and the folks from Smart Growth America sort of made the point that they really need a body of evidence developed that has really studied the implementation and impact of complete streets, not just in terms of physical activity, but in terms of the impact on economic development in the community, because it's the economic development hook that's going to enable advocates to go back to policymakers and advocate for complete streets policies. Having a healthy community is important to policymakers, but if you can focus on the economic aspects of it, that's really what's going to make a difference. So more work is needed in that area. In my zoning study, we have looked at complete streets policies there as well, and we are finding that walking to work and transit use is higher in jurisdictions that do require complete streets policies. Policies regarding parks and open space. There's quite a bit of literature, as Amy suggested, regarding the relationship between park access, availability, safety, renovations, maintenance, and park utilization. Most of the reviews that are out there recommend policies that invest money. Again, that's sort of, I apologize, I didn't expect to get up here and talk about money the whole time, but that's really the root of the problem when it comes to implementation, and what we really need to do is focus on investing in a lot of these great ideas that we know can work. But most of the reviews out there focus on the need for more investment in maintenance, improvements to amenities, recreational programming in existing parks. We don't need to build a whole lot of new parks, but we need to build up what we have and really improve what we have. There are a number of local level natural experiments occurring. In Chicago, we are doing a series of park renovations, and my colleague Sandy Slater is studying this through the CDC Prevention Research Center, looking at these park renovations in low-income areas of Chicago and what they can do to facilitate physical activity amongst low-income residents in the city. Worksite promotion policies, we know that they are associated with higher levels of physical activity and less sedentary behavior. Amy mentioned in her list of worksite policies, transit benefit programs. These can be a big P public policy because they can be considered pre-tax types of programs. And so in order to change and make them pre-tax, you've got to get tax code changes in place. But they have been shown to increase walking and active travel. So these are one big P policy strategy that you can effectuate change in the workplace environment, even if it's at the organizational level. So in summary, and I actually am going to leave a couple minutes on the table, which I never do, so it's really nice. In summary, a wide range of physical activity policies have been studied in terms of implementation. Most of the studies, one of the biggest challenges for those of you who are academics in the room, one of the biggest challenges we often face with physical activity policy is we often are studying policies after they've been enacted and studying their implementation and association. We can do some statistical modifications to sort of make them more rigorous and study differences in communities with and without policies and study changes over time. But you're not going to have randomized control trials with physical activity policy like you are with a lot of the standard bench science work. And so we need more longitudinal work in this area. We need to really, what was really missing, and we started to get at this with the Accelerating Progress on Obesity Prevention report and then the PE report as well, that we really need to look at the amalgam, the whole range of PA policies, and really look at their collective impact instead of just focusing on silos. Right now, our presentations were very silo-based, very sector-based, as the National PA Plan was and is, but in order to really understand the collective impact of these things, we need to somehow figure out a study and research where we can really look at all these things collectively and understand the combined magnitude of impact that they can have on improving physical activity amongst all persons in society. And most of the work in this area has really focused on the education sector. We need to do a lot more work in other sectors of society. And I can't leave without thanking my sponsors, including the Robert Wood Johnson Foundation and NCI and CDC, and my research assistant, Sabrina, who helped me put this together. So thanks very much.
Great, thank you. Yes, let's start the standing active applause here.